Well, good morning. Today, today, City Council will consider a report from Dr. Eileen de Villa to effectively make it mandatory for people to wear masks or face coverings inside businesses or public facilities. Dr. de Villa's recommendation, worked out with City Legal after careful consideration of the legal landscape, would give clear direction on face coverings to help stop the spread of COVID-19. In many respects, from the standpoint of both health and the law, clarity is what is being sought on the matter of face coverings, which has been a topic of active discussion since the very beginning of this pandemic. We are in the midst of reopening our city, safely restarting the economy with an emphasis on the word safely. So we will continue to do everything we can to keep this virus from spreading and to avoid a resurgence of cases like we're seeing in other jurisdictions in North America. You have told us you don't want to see a repeat of what you see when you turn on your TV and see reports from the United States. Wearing fabric masks or face coverings keep you from unknowingly spreading this COVID-19 virus and keeps the people around you from spreading it to you. It is about respecting and protecting each other. It may be uncomfortable, it may look unusual, it may take you out of your comfort zone. I can say that's true for me because I've been wearing a mask regularly in recent times, but our doctor says that it works. Throughout this pandemic, I have been committed to following the advice of our public health professionals. I'm proud to say, without exception. While there has been some tragic loss of life and considerable personal dislocation for many, following that advice is why we have done relatively well as a city so far in avoiding the kind of larger-scale tragedy that we've seen elsewhere. And I thank you for your magnificent cooperation in getting us this far. So I will absolutely be supporting at the City Council today this recommendation, and I believe the vast majority of councillors will as well. You'll see that we're joined today by the Board of Health Chair, Joe Cressy, and Deputy Mayor Michael Thompson, as well as our Medical Officer of Health, Dr. Eileen de Villa. This proposed measure makes sense from a health perspective, and it makes sense from a business perspective. If approved today, this bylaw would come into effect a week from today, shortly after face coverings also become mandatory on the TTC, another sensible measure which I support. Suitable exemptions will, of course, be provided for. Today's report also follows the statement from the GTHA mayors and chairs yesterday, where we all committed to a regional approach on masking. I know that some of my fellow mayors will be having more to say about this very shortly. But given how our residents move around, given how you move around and live your life within this region, it only makes sense to have a coordinated approach. The mayors and chairs unanimously agreed to request the Government of Ontario to implement a mandatory face covering measure for large municipalities. All of the mayors and chairs also committed to working with their local medical officers of health to explore how they can best advance the universal wearing of non-medical masks and face coverings inside businesses and other indoor places where the public gathers. We know we are at a critical time in the fight against COVID-19, and that we must do everything we can to avoid the flare-ups that we've seen in other places, to avoid those kinds of flare-ups in our communities. All of these measures will help stop the spread of COVID-19 right across the GTA, but of course our responsibility is here in the City of Toronto. We know there will be more people back on the TTC. We hope there will be more people back on the TTC. And distancing will become a greater and greater challenge. And we know that there are more and more people, and again, we hope there are more and more people out in the stores and in the businesses across the city. We want that to happen for the sake of our economy and for the sake of returning to a nearer to normal kind of life. Dr. de Villa's advice has been clear for a long time. If you can't keep your distance, and it isn't always possible to do so, then wear a face covering or mask. I am confident that we will get good take-up on this, despite the fact that it is not a usual thing for most of us. Similar to other cities that have made face coverings mandatory, we will focus on public education and communicating the importance of following public health advice. I really believe that people want to protect their own health, but just as much they want to protect the health of others. We've done such a great job of looking after each other during this pandemic and supporting each other. And this is another way in which we can look after each other and support each other. And as a result, I believe that the people of the City of Toronto will do the right thing and wear a face covering. And may I conclude by saying to the people of Toronto, simply thank you for your patience and understanding on this and everything else that you've had to go through that has taken you out of your comfort zone and has put you into a situation where you've had to do things that aren't normal for you or for most of us. Yes, to some extent, this requirement to wear a face covering is a hassle, but I know that you will come through for us once again as you have for the last several months, and that's why we're doing as well as we are. And I would now like to invite Dr. Eileen de Villa to make her remarks for today.
Of course. Thank you, Mayor Tory, and good morning, everyone. To date, my team at Toronto Public Health has investigated over 14,000 cases of COVID-19 in our city. While our local cases, our new local cases, are currently declining, and we have entered stage 2 of the reopening process, the risk of ongoing spread of COVID-19 continues. While the science on masks is still evolving, there is a growing body of emerging evidence that shows that non-medical masks can help prevent the spread of COVID-19, more so if taken along with our other public health advice: to wash your hands often, to maintain physical distance, to stay home when you're sick, and to get tested if you have symptoms of the virus. For this reason, I am presenting a report today to Toronto City Council to require the use of masks or face coverings in all indoor public spaces. We know that some jurisdictions around the world, including many in the United States, are experiencing a resurgence of cases since reopening. And as we approach our reopening, let us not forget that our progress certainly took a great deal of work and sacrifice. COVID-19 is unlike any infectious disease we've faced in our lifetime. Over the past months, we've learned a lot about COVID-19. We know that this virus spreads primarily through contact with the respiratory droplets of someone who is infected with the virus, their cough, their sneeze, or by talking in close, prolonged contact. We've also learned that COVID-19 can be transmitted by people who are infected with the virus, but not yet showing symptoms, or only showing very mild symptoms. And we have learned that cloth masks can help to protect others from our germs. Remember, I wear my cloth mask to protect you, and you wear one to protect me. This is why, in order to be most effective, we need as many people as possible wearing cloth masks or face coverings to reduce virus spread. And we've also learned that this is particularly the case in indoor settings where the risk of virus spread is higher. We've also observed that places that have required mask use have more people complying with the wearing of masks. So this is why I'm asking for City Council to enact a temporary bylaw today, asking business owners and operators to adopt a policy that ensures, or to help ensure, that masks or face coverings are worn by their customers in public spaces under their control. I'm asking that everyone who is able to wear a cloth mask wears one. This does not include people who cannot wear a mask for medical reasons or children under 2 years old. Lastly, I'm also asking City Council to recommend that the province and the Government of Canada enact a complementary mask regulation applicable to enclosed public spaces in our city that are under provincial or federal jurisdiction. I'm asking for these actions so that all enclosed spaces in Toronto will be protected, so we can keep taking care of each other and keep reducing virus spread in our city. I think it's also very important for us to remember that while our COVID-19 case numbers have decreased, this does not mean that there is no risk of contracting the virus in our city. The reality is that the virus continues to circulate, and we still need to be careful. This point is made very clear in the experiences of other jurisdictions. Even in those places that did not have as many cases of COVID-19 as we have had, they are now seeing more cases and clusters now that they've reopened. I cannot emphasize enough how important it is for all of us to remember that we are still in the middle of a pandemic. While we have made great progress together, we cannot take this progress for granted. Now that our city has entered stage 2, we need to move forward with caution and care. I do not take our progress lightly, and I want us to keep moving forward together. Since the beginning of this pandemic, I've asked you to take care of each other. Today, I am making this recommendation and asking for you to do this once again. This is why I'm asking City Council to enact this temporary bylaw today, so more people will wear masks or face coverings in all enclosed public settings and help to reduce virus spread in our city. I'll now turn the podium over to Councillor Cressy to deliver his remarks.
Well, thank you, Mayor Tory, Dr. Davila, Deputy Mayor Thompson. Since day one, Mayor Tory, Deputy Mayor Thompson, and I have committed to two things with regard to COVID-19. First, as a city, we would do absolutely everything within our control to protect our residents. Absolutely everything, always. And second, that our response would at all times be guided by evidence and the best possible public health advice. We did that when we locked down the City of Toronto. We did that when we developed data-driven indicators to guide our reopening. And we're doing that again today by asking City Council to follow our doctor's advice and mandate the use of masks in indoor public spaces. Listen, responding to a pandemic is challenging even when you know what you're up against. Responding to a pandemic when we have a new virus with no vaccine, no treatment, no known antibodies, and constantly evolving science is simply put unprecedented. When Dr. Davila came to us yesterday to propose a new City of Toronto bylaw to require masks, we agreed immediately. While the science of masks continues to evolve, one thing has become increasingly clear. The more we wear masks indoors, the more we prevent the spread of COVID-19. We know that the risk of the virus spread is highest indoors. We know that by wearing masks indoors, it helps to prevent its spread. And we also know from other jurisdictions that by wearing masks, it offers a visual cue to others to do the same. Mandatory masks. Toronto, it is time. In reviewing this bylaw, we have consulted extensively with our medical officer of health and our city solicitor. And while they are both of the opinion that mandatory mask usage would be better mandated at the provincial level, in the City of Toronto, we will not delay. Additionally, we will continue to coordinate with other public health units and other mayors in the Greater Toronto Area to ensure a coordinated regional approach to masking. This has been a challenging time. To the residents of our city, you've been through a lot. You stayed home when we asked you to. You practiced physical distancing when we encouraged you to go outside. You stopped playing in playgrounds, eating in restaurants, even getting your hair cut. You've already done a lot. Now we're asking you to once again do your part. When you're indoors in public settings, wear a mask. The sooner we all do our part, the sooner we'll be able to get through this. COVID-19 has tested our city, and you, our residents, have risen to this test time and time again. Because of you, we will get through this, and we will come out of this stronger and more resilient than before. I'd now like to turn the podium over to our Deputy Mayor, Michael Thompson.
Thank you, and good morning, Mayor, Councillor Cressy, and Dr. Davila. Good morning. Back in May, Council approved my motion to look into the city's ability to require people to wear masks or face covering within businesses, offices, and public gathering places. This motion sets the stage for today's recommendations. I want to thank Dr. Davila for bringing forward these recommendations, which I will enthusiastically support at Council today. Getting our businesses up and running again is in fact very critical to the well-being of our city, but we cannot put lives at risk by doing so. As the chair of the city's Economic and Community Development Committee, I'm working long hours with the mayor, with other councillors, and also city staff to help businesses across our city to restart and to reopen. Our businesses are, in fact, eager to open their doors and to serve their customers. But most of them are also keenly aware of the need to protect their customers and their employees. Some businesses have, in fact, already have asked their customers to wear masks. Others have been waiting for City Hall to provide clear direction. I believe that these recommendations now will give businesses the clarity that they need to ensure that they provide the safety and protection for their customers as well as their employees. Requiring face covering is one of the simplest things we can do to protect each other from COVID-19. The vast majority of businesses that were able to operate through the pandemic have in fact worked hard to follow public health guidelines. I believe that they will continue to do so by following our mandatory face mask bylaw. The bylaw is a clear message to all Torontonians that for their own health and the safety of others, everyone must play their part to overcome COVID-19. And although this bylaw doesn't come into effect for another 7 days, I encourage everyone to start now. It is the best way to protect your health and the health of the city. Thank you.
Good morning, everyone. Thanks for joining us today. We will now open the floor to questions. As a reminder, it is one question, one follow-up. All four speakers are also available to answer any of your questions. First up, we have Ashley from News Talk 1010. Go ahead, Ashley.
Good morning. My first question is for Dr. Davila. In terms of an office building where everyone is physically distanced, would masks be mandatory? And what about if I have friends inside my home that aren't part of my social circle, but we're all physically distanced?
So thank you, Ashley, for the question. The notion here is to try to get at enclosed public spaces. So if it will depend on the circumstances, but we're talking about places where the public has regular and free access to, and where they may be mixing up. And it will depend on the particular workplace. As I'm sure you can appreciate, there are some workplaces that are in fact relatively restricted to the public or have restricted access points. So that's really what we're looking at here. And it is about public spaces where the general public has free and ready access to try to limit the risk and to think about and to provide that opportunity for all of us to protect each other.
Thank you very much. And my next question, I believe, would be best suited for Mayor Tory. In terms of wearing face coverings inside businesses, how will this be enforced or inside public spaces as we're talking about? For example, will a business be fined if there are customers in there who aren't wearing a mask? Who does the responsibility fall to?
First of all, actually, can I just follow up on what the doctor said about your previous question, which is the policy is specifically not meant to apply to the kind of example that was given with respect to a gathering of people for a social gathering, and people, whether they're in the same circle or not. It is meant to apply, as Dr. Davila said, to public spaces, to businesses and shops and that kind of thing where the public would frequent. And a lot of the responsibility and the onus has been placed here, if you look at the wording of the bylaw, on business, requiring them to have a policy with respect to the wearing of face coverings inside their stores. With respect to the question of enforcement, we're going to really proceed no differently than we have done, given the practicalities involved and given, I think, the desire the public have to cooperate to protect each other, which is to say that we're going to rely largely on education and public awareness and that sense that Torontonians have demonstrated so well and so frequently throughout this pandemic, which is they will do it because it's the right thing to do. The experience we've seen elsewhere with transit and with indoor spaces where there have been face covering policies has been that you get very high, 90% plus compliance with this because people know it's the right thing to do, because they want to protect each other, because they don't want to see the kind of spread of this virus that we've seen happen where these kinds of measures have not been undertaken. And so there won't really be an aggressive enforcement, to be candid about it. We don't have the resources to be able to go around and look in every store or look at every person that's in one of those places. We're going to rely on people by and large to get educated. We will help with that and to do the right thing.
Okay, next up we have Linda from CBC. Go ahead, Linda.
Hi, thank you very much. Just wondering what your response is to the province refusing to issue this sort of as a provincial across-the-board policy.
I will just say that when the GTHA mayors yesterday, representing some 7 million people, that we felt in respect of our region that we all represent collectively, including the City of Toronto, but for that matter the rest of the province, that it would be more effective. It's clearer from a legal standpoint, although I think with the help of our solicitors we have great clarity on what we've done today and our authority to do so. But we felt that an order that was going to be consistent by definition because it's region-wide or province-wide would have been better. But in the end, as has been the case throughout many different things, and fortunately in most instances we've been on the same page and we've been in sync with each other, they've made for now a different decision, and we respect that. But we decided to go a direction we felt was the right thing for the City of Toronto, subject to the City Council's approval, and that's exactly what we will do, and I suspect you're going to find before too long other mayors will be announcing the same sorts of measures for their municipalities, similar to the one that's proposed to be enacted by the City of Toronto.
Thank you. And just as a follow-up, just wondering if you have any idea how long this might be in effect.
It actually has a provision in it to have it in effect until the time of the first City Council meeting in the fall. So I think it would be into, I believe, the month of September. I think it's around the end of September. But it's timed around a City Council meeting, at which time, obviously, the Council would have the latitude at that time to extend it or to discontinue it, depending on the health circumstances, which I guess we all hope will be so much better that, a greater sense of normalcy will have returned in every respect, including whether people should be wearing face coverings. But we'll have to see how things go. This will help get us to the right place as quickly as possible.
Okay, next up we have Mark McAllister from City News. Go ahead, Mark.
Question to both the mayor and Dr. Davila. We have all seen videos in the U.S. of people showing up at stores and establishments not wearing masks, forcing their way into these places, saying that they shouldn't have to do that. What's your recommendation to business owners who might encounter that sort of thing here in Toronto?
Well, in fact, the way the bylaw is written, it requires businesses to have a policy. And I think the simplest policy that we've all seen in respect of more trivial matters, if I can call them that, like no shirt, no shoes, no service, would be for a business, as is required by the bylaw, to have a policy that is simply posted there that may say no shirt, no shoes, no face covering, no service. And you know, there will be people who react badly to that. I think they represent a tiny, tiny minority, because I think most people understand those policies. They understand why they're in effect, especially when it comes to health, and they will comply, as much as it may be uncomfortable, because they know it's actually protecting other people from getting sick. And so we'll have to see how it goes, but the businesses will all have to have some kind of a policy as to how they treat people who don't want to comply, and it'll be up to them to do that, and hopefully there'll be as few incidents as possible. Those ones we see, they make it onto TV because they're colorful, if I can call it that, but I think they're pretty few and far between relative to the size of the population that we're dealing with, millions of people who go along because it's the right thing to do.
Do you have a follow-up?
Oh, Dr. DeVilla, you were going to ask the question too.
Yeah, I'm not sure if Dr. Davila wants to follow up on that. Otherwise, I have another question.
Sure, Mark. I can just add a little bit that our experience has been that, you know, Torontonians have really stepped up to the plate. We've certainly heard, you know, a few circumstances or people have raised the specter of non-compliance with some of our recommendations and measures. And while that has happened, as the mayor has indicated, those situations have been very, very few and very far between. Our experience has been that Torontonians are interested in protecting our city, in protecting their families, their neighbors, their friends, and we see this as the next logical step in creating the circumstances that actually allow people to understand what's required of them and how do we get our city back as soon as possible. This is exactly what we're trying to do here, and we've had good success with Torontonians thus far, and we have every reason to believe that we should continue to have that success and that approach demonstrated by the people of the city.
On another note, Cafe TO was approved by council last night. Mayor Tory, do you know at this point how many applications are ready to be approved today, if they haven't been already?
Well, what's been happening is that there have been continuous meetings going on between our officials and the applicants to try and get all of the paperwork, as it were, swept away, and we've really tried to expedite that in any event. And all I can say to you is that we are making an effort to make sure that as many of these as possible, and there have been more than 200 applications so far, are in a position to open, if they're in a position to do so physically, as it were, for Canada Day, which of course is tomorrow. And so I don't know exactly how many will be open tomorrow, but I do know that we're making a big effort to get as many of those applications approved before the holiday begins so that people can have the maximum amount of time to take in the extra revenue that would come from being able to have this extra space available. And some have obviously made a lot of preparations to be ready as of tonight so they can be in business tomorrow.
Okay, next up we have Jennifer Pagliaro from the Toronto Star. Go ahead, Jennifer.
Good morning, everyone. I just had one clarifying question, and I appreciate the information about this being mainly for people in public spaces, enclosed businesses, like going to the grocery store. There's another category of daycares when kids go back to school, and the summer camps, like the ones the city's putting on. Does it apply in any of those circumstances?
You know, it's interesting. I mean, I have the wording here. And I would say that if you looked at it, and I think we might be best to ask our city solicitor to get you an answer on that, but it talks about the operation of a facility or business to have a policy to ensure masks or face coverings be worn by the public in the enclosed public spaces under their control. And it is subject to some exemptions. So I would have said that some of those things are directly within our domain, and as a result, we could, even without a bylaw, say that that's going to be the policy, as we've done in a number of other areas. But if you said, would some of those kinds of spaces be caught under the way this bylaw is worded, I would say the likelihood is yes, and I think that is the intention. While it's not a business, it's a public space, and it's an indoor public space where people gather together. But we could check and get you an answer from our solicitor as to whether she believes it applies to those particular examples.
And I just wanted to ask again, because I wasn't clear on whether there will be a point where bylaw officers will be checking on businesses and whether there are set fines in the bylaw.
Again, with respect to enforcement, I can only say, and again, you may want to talk to the enforcement people. We don't direct what they do. but they are generally charged with the responsibility of enforcing and monitoring compliance with all of our laws and our bylaws. And I would expect, as they have done with regard to physical distancing and as they do with regard to the safety in restaurants and a host of other things, they will be going about their business and monitoring for compliance. And the preference on our part, as we've indicated this morning, is to have a program of education and awareness so that businesses and people follow along with what is the right thing to do from a public health standpoint. But I suspect, as has been the case with other areas that we've discussed over the last few months, we're not going to see big blitzes where people are out there in huge numbers, bylaw officers enforcing the law. We hope people will go along because it's the right thing to do, and I'm quite confident that they will.
So just with respect to the issue of camps and childcare and schools, those are actually not contemplated in the bylaw at this point in time. We are looking to the province and the feds, certainly, to look at those areas that are under their jurisdiction. There's a recommendation there in that regard. We are looking primarily at businesses and facilities. There are some recreation facilities as well where we have to think about where the public might be accessing. It is a little, it's a little nuanced, but as we put this forward in front of City Council today, my hope is that it will start to become clearer around which circumstances require that, and that will be largely taken care of by having those policies. And part of the policies that we're asking for from businesses and operators of facilities is to make it very clear through signage when and where the mask covering or face covering is required by members of the public as they access the enclosed public spaces that are under their control. So you'll see that come forward, and I'm sure that my colleagues from the City Solicitor's Office will also be able to provide further clarification to some of the questions.
Okay, last questions are from Jeff Gray from the Globe and Mail. Go ahead, Jeff.
Oh, hi, thank you. Yeah, just wanted to clarify that about where it applies because like, for instance, what about food prep? I've been in a fast food place and I've seen staff working very close quarters preparing my food and not wearing masks. Does this apply to them?
So the issue is that in this province, there is occupational health and safety legislation. So when we're talking about that which applies to employees or workers, what's relevant is the requirements under occupational health and safety. Here, and we're talking about, my purview is over public health. And so we're talking about those things that impact directly on the health of the general public outside of the context of occupational settings. So those who are patrons, although there isn't dine-in service quite yet allowed, but there are opportunities for people to go and pick up food for takeout, for example. If you are in an indoor space that is publicly accessible, then yes, you should be, and you're not an employee, let's be clear, member of the public going into an indoor or enclosed public space, yes, you should be wearing that mask or face covering under the terms of this bylaw and what it requires of businesses and facilities.
All right, and to follow up then to either you, Dr. Davila, or the mayor, just what are you expecting residents to start calling in, 311 or snitch line or something like that to complain when they see businesses that clearly aren't following the mask policy?
Well, I'll let the mayor answer as he sees fit, but in fact, I think our expectation of residents, as it has been all along, is to work together, to do our part, each of us doing our part to protect each other and to protect our city. We recognize that we've asked much of our residents over the last several weeks because of this very unprecedented situation. But our city has risen to that challenge. We've seen residents step up and take the necessary actions to protect themselves, their families, and their neighbors and the city writ large. My expectation is that residents will want to continue with that course of activity, continuing to protect themselves, continuing to protect each other. That's what I've asked all the way through. I'm asking that again, and I believe that the residents of Toronto are ready, willing, and able to do just that. I'll hand it over to the mayor if he has further comments.
Just to say that people call 311 every day in huge numbers, and we're very glad that they do because we're happy to be of service to them. And some are making inquiries about service, others are making complaints or bringing things to our attention, and I'm sure they will continue to do so, and we find all of that useful in terms of trying to serve the people better. But the bottom line is that people will go along with this because they know it's the right thing to do to protect each other, and I think that they will continue to do that, and some people will phone, some people won't, but the bottom line is I think most people are going to be doing what we've asked here, which is to wear the face covering because they know that's going to get us back to a normal life and get the economy going again and protect people from getting sick, and that's why they'll do it, and so we won't have much of a problem in that regard.
Okay, that's it for today. Thanks, everybody. Have a great day.